Well, John Sculley led Apple from 1983 to 1993. In that time, the company launched groundbreaking products like the Macintosh personal computer. During his era leading the company, Apple's revenue grew 1,000%. Though he's no longer with the company, he is still involved in the tech space, particularly concerning personal health. Joining us now to talk more about all of this is John Sculley, former Apple CEO and current CMO and chairman of RxAdvance. John, great to have you with us on the show. We will touch on Apple in a minute, but first, what does RxAdvance bring to patients' lives that they don't get with the current infrastructure we have in the healthcare system?
I think the way to look at it, Nora, is that in this $3.6 trillion U.S. healthcare industry, McKinsey Global Institute estimates there's $900 billion of fraud, waste, abuse, and misuse and avoidable costs. And we focus at RxAdvance on how do you take process automations, really smart process automation using a lot of machine learning and AI, and go in and replace a lot of those inefficient ways that things have been done in the past, which automation is able to do. And we've seen automation have huge impacts in financial services and e-commerce and other industries, but the health domain is so complicated that it's been a long time for the high-tech companies to learn how to get into the health domain with its complexities and bring in things like smart process automation. That's what we do at RxAdvance. We're several $billion in revenue now. We'll probably be well over $3 billion next year in revenue. And so it's a high growth, important part of the healthcare industry.
And John, how do you go about lowering the costs of drug prices? It seems to be a resounding issue across the healthcare space. How are you doing that with RxAdvance?
Well, the drug prices can be brought down a lot by bringing down the infrastructure around drug prices. So for example, you've got the pharmaceutical companies that are interested in getting the products listed on what are called formularies. So there'll be a priority of choice by physicians in various hospitals and clinics. You've got the large pharmacies that also have their priority lists in terms of which products are going to be given the most attention. And so all of that data between the pharmacies, between the pharmaceutical companies, the hospital systems, all of that is managed by what are called PBMs, pharmacy benefit managers. We never actually touch the product, we touch the transaction process of all of that information. And traditionally, it's been a very inefficient system. Thousands and thousands, tens of thousands of people involved with things like fax machines and call centers and things like that. The way we can bring that down is we work with the pharmaceutical companies and the pharmacies and the providers and the health insurance companies, and we give them better information. We reduce the cost of that processing of transactions, and it can save literally hundreds of billions of dollars across the industry.
And John, we are seeing, big tech companies trying to revolutionize healthcare, especially with wearable health tech. We're seeing, Apple with its smartwatch. We're seeing Google having acquired Fitbit, even Amazon launching its Halo device. Do you think these companies can dabble in the healthcare space without opening up more concern about data privacy, antitrust scrutiny, monopolistic behavior? Do you think that is possible without additional scrutiny?
Each company is looking at it differently. First of all, there are incredible advances that are being made with sensors. And you combine that with machine learning and artificial intelligence, the accuracy of the sensors for all different purposes is going up. So Apple's done a terrific job with their Apple Watch to bring some things like the ability to monitor your heart rate and ability to monitor your sleep patterns and things like that. But we're just barely touching the beginning of that industry, which is why I think that Google wants to buy Fitbit, because that gives them an opportunity with their incredible deep domain expertise in artificial intelligence and machine learning to take advantage of that. So I think we're going to see advanced sensors in all kinds of products. It won't just be wearables. It could go into smartphones. It could go into ambient sensors, which means sensors that are in a room, particularly as aging people are no longer going to need to go to hospitals. Hospitals are closing down maybe 40% of their beds. More of those people will be treated at home. Sensors can be one of the ways that we can keep track of those people and serve them. So lots of technology is coming into the healthcare industry. The other thing I would point out, Nora, is why the high-tech companies like Amazon and Apple and Google are so interested in healthcare, is that if there is a change in administration, the amount of investment that's going to be going into healthcare next year will be huge. Not only will it benefit the incumbents, so you'll probably see the stock prices of almost everybody in the healthcare industry, if there is a change in administration, go up next year, but you'll also see the big tech companies moving even more aggressively into taking advanced products. The big difference of the incumbents versus the high-tech industry is that the incumbents are all focused on sick care. It's a sick care oriented industry. Chronic care patients are most of the cost in the healthcare system. But the high-tech companies are interested in preventative care and wellness. And that's why products like Apple Watches and Fitbit and Amazon just came out with one called Halo.
Right.
Why these products are focused on preventative care and wellness. And that's a very rapidly growing part of the industry.
And John, the healthcare space is also set to benefit from 5G. I know that I think the first cellular network, 1G, first came out when you were in charge at Apple. How significant do you think 5G is in the life cycle for Apple products and for us as consumers who are trying to access these kinds of health tech devices?
Well, I actually know a lot about wireless. I was part of the founding team of Metro PCS that we built up to a $9 billion business. We sold to T-Mobile. And I've still stayed involved with the wireless industry. 5G is going to be very important, but not right away. So the impact of 5G is probably starting in 2025 out through 2030 and beyond. It takes a long time to put the new infrastructure in that will take advantage of it. Apple's just come out with their first 5G phone with the Apple 12, which people are excited about. But it's a relatively small availability of all of the advantages that 5G will ultimately bring now. So we're just at the beginning of 5G. So its impact on healthcare is relatively modest in the next couple of years. But if you take the 25 to 2030 time period, 5G will play a much more significant role.
Yeah, and John, analysts and consumers have pointed to this 5G capable device or devices from Apple as the trigger for the next super cycle for the company. What do you foresee being the next frontier for Apple, whether it's in the healthcare space, VR technology? What do you think is the next big thing for the company?
Well, I don't have any inside information. I'm no longer with Apple. It's been a long time since I was there, but I'm very connected with lots of things that are going on in the health tech industry because I'm an investor in quite a large portfolio of companies and actively involved with those companies. So what I think is that I listened to what Tim Cook says publicly, and he said that healthcare will be maybe the greatest legacy for Apple in decades from now. Apple has now started to put their first microprocessor that they're manufacturing into the Apple 12. It's called the A14 processor. It is so far advanced over anything that's ever been in a smartphone before that it gives Apple the ability to have a real capability to add all kinds of health tech services, including things that use augmented reality, even virtual reality, that take advantage of their A14 processor. But Apple's been very clear. They don't want to see the data. They have about 140 healthcare partners, premier partners across the United States, and they want them to be the ones who have the contact with the patients, taking advantage of the high security that Apple has and the incredible processing power it has inside of an iPhone. So each company is looking at it in different ways. At RxAdvance, we work with Amazon. They've been rolling out now what we do with our pharmacy benefit management program for their employees. We love working with Amazon. It's been a great relationship for both companies, and there's just going to be a lot of new innovation, I think, that's coming to healthcare. It's such an inefficient industry. It's just a perfect place for innovation to take place, particularly from new companies. Most of the market cap growth has not come from incumbents getting more things in the tech world. It's coming from new companies like Livongo, like Teladoc, like MD Live, like GoodRx. These companies have been incredible successes, and I believe that entrepreneurs will continue to be the ones on the cutting edge of innovation for the healthcare industry.
All right, great points and excellent insight, John. Thank you so much for your time today. That's John Sculley, former Apple CEO and current CMO and chairman of RxAdvance. Thanks again.